You know, we all put a lot of trust in our annual checkups to keep us healthy, especially as we get older. But what if I told you that some of the most common tests, the ones designed to protect you, could actually be putting you at risk? Well, for a lot of folks over 70, this is a hidden but very real danger.
Okay, so this number you're looking at, it's a big one. According to recent studies, a whopping 37% of medical tests given to seniors don't just provide answers. They can set off this whole domino effect of unnecessary treatments, pretty serious complications, and even lifelong side effects. And here's the really concerning part. The vast majority of people in this age group have no idea that they're being overtested. You go in for a checkup expecting some peace of mind, but you might just be walking into a situation that creates a whole lot more problems than it solves.
So, we have to ask, right? Are your checkups really keeping you safe? Or are they maybe exposing you to risks you don't even need to take? In this explainer, we're going to pull back the curtain on the 5 health checkups that seniors should probably start questioning, all backed by solid science. So, let's get into it and start our countdown at number 5.
All right, coming in at number 5, we have the bone density scan. You might know it as a DEXA scan. It sounds totally harmless, right? A quick, painless procedure to check for osteoporosis. But for a lot of seniors, this simple little test can kick off a wave of unnecessary fear and treatment.
So here's the deal. The promise is pretty straightforward. Find osteoporosis early to stop bones from breaking. But here's the problem. In older adults, these scans almost always show some bone loss because, well, it's a natural part of getting older. It's like getting gray hair. This diagnosis often leads to prescriptions for powerful medications for what's really just mild, totally age-appropriate bone thinning.
Now get this. What was the actual benefit of those medications? A major study found that for women over 70 with just mild bone loss, these drugs only reduced the risk of a fracture by 0.3%. Over 5 years. That benefit is so tiny, it's barely a blip on the radar, especially when you start weighing the potential side effects.
And that brings us to the story of Rose, a 76-year-old piano teacher. After a routine scan showed that mild bone loss, she was put on medication. But pretty soon she developed horrible jaw pain and reflux so bad she couldn't even play the piano anymore. Think about that. The treatment was causing way more harm than the thing it was supposed to prevent.
So what's a better way to go? Well, instead of risky meds, simple things like strength training and eating right have been proven to slash fracture risk by over 20%. I mean, that's a massive difference compared to that 0.3% from the medication, and it comes with 0 negative side effects. Okay, let's move on to our next 2, which are all about our most vital organs.
All right, at numbers 4 and 3, we've got brain and heart scans. These often get ordered when seniors mention things like memory issues or feeling tired. And the intention is good, get a closer look. But a lot of the time, that closer look can unleash this whole cascade of fear and invasive, totally unnecessary procedures.
Let's start with brain MRIs for just mild forgetfulness. The promise is to find the cause, right? But the problem is, these scans almost always show things like white matter spots or a little bit of shrinkage, which are often just normal signs of brain aging. They're like wrinkles, but on the inside. But seeing that on a report can cause a huge amount of panic, leading to a whole battery of invasive and often needless follow-up tests.
And this chart just lays it all out, doesn't it? A study found that while 86% of these scans showed some kind of abnormality, only a tiny 3%, just 3, pointed to a condition that could actually be treated. And yet, over 11% of these folks were sent for really invasive procedures like spinal taps, all based on findings that were probably completely harmless.
Now for number 3, the cardiac stress test. It's designed to find blocked arteries, sure, but in people with clear symptoms like chest pain. When it's used for something vague like feeling a little tired, it becomes super unreliable. For seniors, it can be wrong up to 40% of the time. That means it's screaming fire when there's not even any smoke, and that can lead to risky procedures like putting in a stent you never even needed. Just look at Raymond's story. He's 75, mentioned he felt a bit tired walking up hills. That led to a stress test, which led to a procedure to place a stent. He ended up with complications, spent nearly a week in the hospital, and his fatigue, it never went away because it wasn't a heart problem to begin with. So what's the smarter play here? Well, for mild memory concerns, a simple sit-down cognitive screening test is a much better first step. And for heart worries without major symptoms, a simple resting EKG or a low-radiation calcium scan can give you good information without all the risk of false alarms and unnecessary interventions. Okay,
I'm going to bet this next one is going to surprise a lot of you. The colonoscopy is, a cornerstone of cancer screening. But at number 2, we really need to talk about why, for people over 75, the risks can start to seriously outweigh the benefits. Let's just do the math here, because these numbers are stark. A massive study looked at over 1 million Medicare patients and found this wild ratio. For every 1,000 colonoscopies in people over 75, only about 2 lives were saved from cancer. But in that same group, over 20 people suffered serious complications. We're talking bleeding, bowel perforation, issues from the sedation. That's a 10-to-1 risk-to-benefit ratio. That's a bet against you.
And this is exactly what happened to Dana. She was a healthy 73-year-old, no symptoms, no family history of colon cancer. But she was urged to get a screening, and during the procedure, she suffered a bowel perforation. She ended up in the hospital for 9 painful days. The screening test itself caused a life-threatening injury.
So here's something you might not know. The official guidelines actually agree with this. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people. And for those who do need screening, there's a much safer option, the FIT test. It's a simple stool-based test you do at home. No awful prep, no sedation, and absolutely no risk of perforation.
And here we are, number 1, the most overused, potentially dangerous, and often misleading checkup for seniors, the full-body CT scan. You see these marketed in those executive health packages, promising to find any little problem early. But the reality is way more frightening.
Okay, brace yourself for this number because, wow. A recent study suggests that the huge increase in CT scans might now be responsible for up to 5% of all cancer cases in the entire country. Let that sink in for a second. The test that is supposed to find cancer may actually be causing it.
And to really get a sense of that risk, look at this. We are now putting CT scans in the same cancer risk category as drinking alcohol every single day. A single full-body scan blasts you with a dose of radiation equal to about 500 chest X-rays. That is a massive exposure, especially for a screening test when you don't even have symptoms.
And look, you don't have to take my word for it. The verdict from the absolute experts, the American College of Radiology, could not be clearer. They state flat out that for general screening in people without symptoms, there is no proven benefit, only significant potential for harm. Why? Because they find tons of harmless, age-related little spots and cysts that just lead to this terrifying spiral of more tests, biopsies, and a whole lot of anxiety.
So, after all of this, what's the big takeaway? It's about empowering yourself. It's about becoming your own best advocate. Before you agree to any test, especially after 70, you just need to ask your doctor these 4 simple but absolutely critical questions. Understanding the why, the what if, the risks, and the alternatives, that's the key to making sure your medical care is truly helping you, not hurting you.
And that really leaves us with this one big question, doesn't it? In modern medicine, it's so easy to believe that more testing, more tech is always the answer. But as we've just seen, sometimes the smartest and frankly the healthiest path is the one that involves just a little more careful consideration, a few thoughtful questions, and maybe the courage to say that doing more isn't always doing better.